Just a bit of housekeeping. You will see our own photographer, Melissa. She's going around the room taking photographs. Melissa won't be offended if you just put up your hand and say you don't wish to be in a photograph. So don't be afraid. And that's Melissa over there in the corner. So we do have a coffee break coming up after our next speaker. So just in case you're looking for a few minutes. So yeah, that'll be coming up after the next speaker. I want to introduce our next speaker. Ethel Wallace is her name. So Ethel is a registered nurse with 20 years experience. Ethel came to complementary therapy through her love of sports and is actively involved with her local GAA team. Ethel has been working as a complementary therapist for 15 years. Most recently with Westmead Palliative Care Team, visiting clients in their own home and offering a range of treatments. Will you welcome, please, Ethel Wallace.
Hello, everybody, and firstly, thank you very much to Naomi and Anya for inviting me to speak here today. It is an honour, and I think you've all mentioned GAA enough that I need to say we won the county championship last week. We're going to Leinster. It is Westmead, but we're still very proud. The benefits of holistic therapy. Why did I do this? I started because of my love of sport. Started doing massage therapy years ago. I am a nurse. That is my background. And working with the GAA teams, I worked with massage therapy, sports therapy. I began to find that I enjoyed more the quieter times, the holistic stuff with people. When the opportunity came in 2000, I got offered the job 5 days into COVID, and then sat patiently with the palliative care team for 5 months because I couldn't go into people's homes. I have slides. I'm not good with this, so please forgive me. And Westmead was one of the first palliative care teams to offer somebody to go into their home. Why go into the home? In Westmead we have a fantastic service called LARC, and this is coming from a cancer care point of view. But what people were finding was it was challenging to get there. When you were offered a treatment, but it was, you can go to the Hudson Bay for it. Well, I have a medical appointment and I have to go to physiotherapy, and I can't really ask my carer to bring me again. So the reason Westmead Palliative Care Team was that I would go directly to your home. I would provide the treatment in your home, whatever it may be. I came with my table, my bag. Sometimes we were in the middle of the kitchen with people eating their dinner beside us. Sometimes we were up in a room. Sometimes we were sitting on the couch with the fire on. Whatever worked for you was the way we worked it, and it worked very, very well. So that is who said working with it. My goal is to make sure that every client I see leaves feeling relaxed and mentally and physically. It was fantastic. They smiled when I opened the door. I didn't come with a diagnosis. I didn't come with treatment. I didn't come, while I have a background in nursing and I often knew their diagnosis, they didn't need to discuss that with me. We discussed other things. We discussed football a lot. Motor neuron disease is a progressive neurological condition that attacks the motor neurons or nerves in the brain and spinal cord. This means messages gradually stop reaching the muscles, which leads to muscle wasting and weakness. Everybody here knows this. I am not going to start talking about motor neuron and the pathophysiological, how that works. But regular massage can improve the tone of your muscles. So by having a deep tissue massage, a gentle massage, an Indian head massage, it helps you relax. It helps you the tension in the body. So you will feel better. If you feel better, you are going to be more active, helping you live your daily lives. Massage therapy can diminish some of the side effects of serious illness and treatments by supporting the immune system, helping physiologically and offering a normal, calming, relaxing environment. As I said, you're feeling better. The muscles are not as tight, so you have more movement. Everything, your immune system is better. Turning down the dial and anxiety and thus supporting return to health or reach the goal, reach the end without as much fear and anxiety. People are anxious. It's a diagnosis that we don't know what to do with. We don't know where it's going. I have worked with a number of motor neuron. In my time with the palliative care team, I've gone into a number of motor neuron. And what people find is the tension, the muscle tension, so that you get the relief from that is very, very beneficial. The history of massage. Thousands of years, some form of massage or laying of hands has been used to heal and soothe. Western medicine is only catching up. The Westmeath Palliative Care team were one of the most forward-thinking in that they brought somebody else on board to work alongside them. To the ancient Greek and Romans, massage was one of the principal means of healing and relieving pain. Hippocrates, the father of Western medicine, says the physician most experienced in many things, but assuredly in rubbing. For rubbing can bind a joint that is too loose and loosen a joint that is too rigid. We need to bring our Western medicine alongside our complementary therapy. There's huge benefits. More and more people are realising the importance of touch factor in providing massage, for providing comfort and reassurance to people suffering from distress, disease and injury. I would say, people ask me, what treatments do you do? I tend to say none of them. I can give you a list of 20 different courses done, from Indian head massage, Swedish therapy, oncology massage. When I go and sit beside you on the couch and I ask, what do you want today? You usually get a mixture of everything, because that's what works today. Tomorrow we can do a deep tissue massage because you have to do a 5K and you're walking and you've done that and the muscles are sore. It is get the therapy that works for you. And it can be a combination of all of the above. If we go over to the lovely spa they have here, it's a very fixed treatment. It doesn't need to be. It can be what you need today. And it can be a combination of treatments. An Indian head massage for somebody using a mobility wheelchair can be done. It just needs adapting a little bit, and it just needs the therapist to be a bit flexible. Your therapist will be flexible. They can be flexible. The actual physical touch of another person can have an incredible effect on your sense of well-being. We're so busy with treatment, we're so busy with diagnosis, we're so busy getting our home care packages, we're so busy looking for our carers allowance. We forget to touch each other. And sometimes that, the last lady who spoke about it, it's fantastic to be back after COVID. It's fantastic to be able to touch people after COVID. How did we miss the hug, the touch of a friend? Touch therapy is amazing. Holistic massage is about relaxing. It focuses on giving the client time to recover from the stress of daily life. Holistic massage works on physical level by improving drainage, aiding the delivery of oxygen nutrients to the body cells, while at the same time eliminating toxins, releasing muscular tension and boosting the immune system. Am I pressing the right button? Very, very tiny bit. I am not the expert in anatomy and physiology. The reason I have put it in there is for the non-experts here, that I have two systems, the muscular and the nervous system, because I felt they were two systems that were very predominant in motor neuron. The muscular system is one of the most obvious systems to receive benefits of massage because that's what we're touching, so we're going to feel it. Massage movements move the muscle against the bone, stimulating the underlying cells and tissues to increase blood supply. I should stop reading and just turn around and talk. I'm getting tongue-tied. Muscles which are weakened due to long periods of disease or disuse can be helped with massage and can be more readily return to normal or aid in slowing down the progression of muscle wasting. Example, My dad, being a typical farmer, slipped and cut his hand 4 fingers across when galvanised, and he was left like that. He now has full use of his hand because we massaged it and we massaged it and we massaged it and we massaged it, and we got movement back into it. So whatever the stage of your disease progression, you can get benefit from massage, you can get benefit from movement, you can get benefit from the underlying tissues and cells being moved, being oxygenized. The nervous system. The surface of the skin is rich in sensory nerves. As the massage strokes are carried out, these nerve endings will, with soft effleurage strokes, the nerve endings will be soothed, while hacking, cupping and deportment movements will stimulate the nerve endings. Right now, my hands, my nerves are shaking. Touching and just doing that will soothe down that nervous energy, will help soothe down them nerves lying on that top layer of the skin. That will help soothe us, that will help calm us. That may help us get a better sleep tonight. A better sleep helps us all. Touch therapy. When somebody is feeling unwell, living with the disease process such as MND, life can become very hectic and very focused on a diagnosis, treatment and care required, as I was saying. Allowing time for touch in your life will allow you for the treating of the whole person, including mental and social factors, rather than just symptoms of the disease. Just take time out for yourself and for the carers. 100%. What I would find sometimes when I would go into a home with the palliative care team is they knew somebody was in the room with the loved one. They went and had a cup of coffee and they just sat in quiet because they didn't have to be on. There was a time, unfortunately, that has stopped now, but it's something I'm sure that MND can look at, is that they would pay for the carers to get a treatment. So while I went into the home and looked after somebody, I also gave their carer a treatment, and they got an hour of relaxation. Because if you are doing a lot of movement, you're stressed. If you're looking for stuff, you're stressed, and you can care better if you're relaxed. Thank you for listening today and allowing me the chance and the honour to speak at your conference. I really appreciate it. Thank you.